Colon cancer is one of the top 3 deadliest cancers in Hawaii, but with prevention and action, you can mitigate future challenges. We have Christina Teal from the Department of Health and Dr. Jane, gastroenterologist, joining us here in the High Now studio. Welcome in.
Thank you for having me.
Thank you very much for being here. Very important topic we're discussing today. Colon cancer, as we mentioned, unfortunately, one of the top 3 deadliest here in Hawaii. But Doc, for people who don't know, what is colon cancer?
Sure. So cancer in general is a disease in which cells of the body grow out of control. Colon cancer specifically arises from polyps, which are precancerous cells lining the colon or large intestine. As you mentioned, it is the 3rd most common cause of cancer death here in Hawaii, and it's estimated that each year there are about 700 men and women that are diagnosed with colon cancer here in Hawaii, and about 225 deaths. We know that colon cancer increases as we get older, incidence increases, but we've seen an alarming rise in younger patients diagnosed with this disease. And in fact, it's estimated that within the next 10 years, this will be the leading cause of cancer-related deaths in people younger than 50.
Wow. What are some of the symptoms or things that people need to be aware of, Christina?
Some of the warning signs and symptoms for colon cancer include blood in or on the stool, diarrhea, constipation, or if the bowel doesn't feel empty all the way. There's abdominal pain, aches, cramps, unexplained weight loss. Sometimes in early stages of colorectal cancer, there are no symptoms, and that's why it's so important to get screened.
Who should be getting screened? Like, what is the age we're looking at as, again, it continues to appear younger and younger?
Yes. The Centers for Disease Control and Prevention recommend everyone 45 to 75 years of age get regular colorectal cancer screening, or sooner if there are any symptoms or if there are any risk factors other than symptoms. It's very important to get screened because colorectal cancer almost always develops with precancerous polyps, abnormal growths in the colon or rectum. Colorectal cancer screening could find these polyps and get them out before it turns into cancer.
Dr. Jane, when it comes to some of the screenings, what options are available currently right now? Because people can go about screening in different ways, right?
Yeah, 100%. So there are a lot of different options available for screening for colon cancer, which is one of the good things. Colonoscopies, as Christina mentioned, are the gold standard. Because not only are we detecting colon cancer at an earlier stage, but we can also prevent it by the detection and removal of precancerous polyps. So we're actually looking inside the colon or large intestine with a long, thin tube with a camera. It's about 6 feet. And through the removal of these polyps, we can prevent that cancer, but there are also other options as well. So one example is a stool test that we can do at home that's detecting microscopic blood. But it's important to note that any of these tests that do come back abnormal, besides a colonoscopy, do require a follow-up colonoscopy to be done in a timely fashion. So whether you choose a colonoscopy or a stool test or one of the other various tests, that's not as important as getting that test done. So we tell people the best screening test for colon cancer is the one that gets done.
Absolutely. And Doc, what do you have to say to people who are maybe hesitant about the process of getting a colonoscopy? I know it involves different things that people have to do prior to the procedure, but what do you want people to know about it? And what do you say to people who are maybe hesitant about doing it?
Sure. So I think what it's really important for people to know is that even though colon cancer is very common, as we talked about, it is highly treatable, especially if we catch it in early stages, and it is preventable through that colonoscopy. So it's really important to talk to your doctor, ask them when you are due for screening, and which test is best for you.
Christina, what's the best resource to utilize if people want to learn more, find out about the services, and again, be more cognizant of the rise in colon cancer and things that people need to be aware of?
To get more information about colorectal cancer and screening options, you can visit getscreened.hawaii.gov.
Thank you very much for being here, Dr. Jane and Christina as well. And we'll have this entire interview posted at HighNowDaily.com.